If I can add a little bit to everything Gerhard has said, but the other piece is financial investors don't like new structures. In global health, what I've seen in the last 3 years is I've literally had investors say no to my fund because it wasn't a crazy, wacky enough structure. They just want to do new forms of financing. My job in 2007 timeframe, I was one of those people that created those structures that blew up credit markets. New structures are not necessarily better. So I tend to favor structures that are somewhat understood. Of course, we're adding a bit of spice here with the layers and with the technical assistance on top, but fundamentally a GP-LP structure is something pension funds know well and understand. It's something governments have done before. So you've heard from Gerald at KfW, they've done this a great number of times. We've even had interest, they don't want to see us at Fund 1, but at Fund 2, by groups, very large insurance companies in Europe that would look at our Fund 2 if it was a little larger. That's the other piece that fund managers like me also struggle with. We need to have a big enough fund to accommodate those bigger checks. And that's where the fund of fund can unlock things. But to give you points of success with this structure, the Canadian government has launched 2 very large funds of funds programs. We're on the 3rd now. They have their issues. The money, goes to the same individuals. Fundamentally, they just need those programs to be bigger. But the very first time this was done, the government put in 350 million. The fund of funds raised 1.3 billion. The second time around was 450. 1.7 billion raised for fund managers. And the latest one, maybe Gerhard will know the stat, but I think it was also 450 million, and it's in the range of 1.5, 2 billion once it's finally closed. And so you see that the structure can have a ton of success mobilizing the private sector. It takes time. But it has a chance of success. And I think what I particularly like about the structure Joanne has there is that the donor capital ideally will be recycled to bring in more private sector dollars over the course of time. So you could have a Fund 1, a Fund 2, a Fund 3. Fund 1, it's a small crowd. It's the really committed. It's donors, foundations that invest their endowments for impact. Fund 2, you start to, maybe at Fund 1, you bring in a few new players. Fund 2, you bring in more, and so on and so forth. Because we really have to crack the nut of that $2.1 trillion that's changing hands. Let's try to bring a little bit for healthcare and women's empowerment, because without intervention, that money doesn't know how to do this. Often that's the thing, right? We have to provide these training wheels, and our fund is an example of a training wheel where we do the global piece, but we keep investors where they're comfortable, where there's a track record of North America, Europe returns. Like, we're one example, and then other examples will do different parts of the ecosystem, and hopefully we can partner with those groups.
I see Gerald's hand is up.